Welcome back to your tip of the day from Dr. Jerry Simon at Dental Care of Stamford. We've been talking these last couple of conversations about periodontal disease or gum inflammation and damage and how to avoid it to keep your mouth as healthy as possible. We haven't spoken very much about the fact that this inflammation that is caused by the body naturally trying to fight the germs actually spreads throughout the entire body and can cause a lot of complications that have nothing to do with your teeth. Studies have shown that these inflammatory chemicals that your body is making with good intention, by the way, your body's trying to fight the germs, but these chemicals that your body is making to fight the germs circulate through your bloodstream and can cause an increase in heart attacks, increase in strokes, worsen diabetes, cause preterm births, and many other problems because the body is not designed to be constantly fighting germs and causing all this inflammatory response. And so the benefit of keeping your mouth healthy and free of periodontal disease goes far beyond your teeth. What it does is it helps to lessen the risks of heart attacks, strokes, and various types of cancer have been associated with increased inflammatory chemicals circulating in the bloodstream. And recent research has shown that even the COVID virus is more effective, causes more harm, causes more damage in people with increased inflammation in their body. And whether that inflammation is from anything, including periodontal disease, it's very important. As a matter of fact, studies have shown that people who have increased inflammation due to periodontal disease, in comparison to others, do worse with the virus. So again, my objective for you is to keep your mouth healthy as a dentist, but in addition to that, to also make you aware that the most important thing is to be healthy in general, and that way we can reduce inflammation. By reducing inflammation, you'll be better off in general. So, a brief reply to a couple of questions that we've gotten. How often should you go to the dentist? You should go to the dentist theoretically twice a year, but you base it on the results of your examination and findings. So if you've got bleeding points, then you should go more. If you've got fewer bleeding points, you should go less. So our standard for periodontal health is less than 5 bleeding points in the entire mouth during the course of your periodontal examination, and we count them up every time you come. So, and we'll tell you. So if you've got less than 5 bleeding points, if you don't have gum pockets, I explained to you about gum pockets, and you don't have bone loss, then typically twice a year will suffice. As you have more and more bleeding points, then you will need to come more often and work on your home care. So it's a team effort. We want to make sure that we're keeping your mouth as healthy as possible, both for avoiding periodontal disease and for your health in general. That's why we'll tell you how many bleeding points you have, we'll tell you how many pockets you have, we'll tell you how big the pockets are, how deep they are, and we'll point out anything that you need to know to stay healthier. So, final comments. If there are other questions that you have, we welcome them. You can send them into dentist@dentalcarestamford.com or call the office. We'll be happy to help you. Again, this is Dr. Jerry Simon at Dental Care of Stamford with your tip for the day on avoiding periodontal disease and health complications because of it. Take care. Stay well.